I'm going to go over just a couple of issues of some commonly overlooked conditions that commonly affect plantar fasciitis, patellar tendonitis or runner's knee, IT band issues, and back pain. When someone comes in with a condition such as pain in the knee, there needs to be two diagnoses that need to be made. The first diagnosis needs to be what is actually going on in the knee, or what is the source of the pain. And the second issue that needs to be diagnosed is why did you get that pain in the first place? And if the first diagnosis, just the pain is only addressed, typically you might not get the response to care, or the pain might become chronic or reoccurring. So if I come in with, I'm having pain in my knee, and I go to a clinic and they say, hey, you have tendonitis in the knee, runner's knee, and what we need to do is an injection, ultrasound, deep tissue, electric muscle stim to that tendon, and that's it. That should resolve some of the tendonitis or inflammation of that tendon. But what wasn't addressed is why did you get that patellar tendonitis in the first place? And this has the same thing with the back, plantar fasciitis or IT issues. So I'm going to give you a couple ideas to look into, and then maybe you could take these to your doctor and talk to them if they haven't addressed these issues. So when we're looking at any type of IT band, knee pain, foot pain, first thing we want to do is start with the feet and work up to the back. Okay? We need to look at the arches of the foot. Sit down on a chair with just your feet on the floor. Make a mark on the inside of your arch, and each mark on the inside of the arch, and just take a little ruler and measure that distance to the floor. Let's say it's a ½ inch. Now stand up and look at that mark again. Is it still a ½ inch when you've gone from seated with your feet on the floor to standing, or has one side dropped down a little bit? If you're dropping down, what you're going to do is that arch could rotate down or pronate in, and what that could do is lead to the knee to buckle on that side. Now the hip's down on this side. You don't walk around like this, so you have to balance it up like this. So if that arch is not addressed, you could get the therapy on your knee, but then you get up off the table and start walking around or run around, that arch is collapsed, the knee's buckled in, commonly say come back. A lot of these overuse injuries occur because the body, the joints and the muscles can't absorb the force that you're placing on it. You have some tightness or restrictions into that joint, and then you end up with the tendonitis or bursitis or pain in that joint. So you need to look at the arch. Another thing what you need to do is look at a Q angle. A Q angle is a measurement from your hip to your knee. And if this Q angle is larger than it should be, it could cause biomechanical flaws in the knee and the back. And the Q angle, again, could mostly be fixed with some type of arch support. As we move up from the knee, another overlooked issue is the sacroiliac joint. The sacroiliac joints are those little bumps you feel kind of in the back. And the purpose of the sacroiliac, you rotate when you walk. And a lot of times what happens is that sacroiliac joint up in the back area, hip area, could become locked or fixated. If that becomes locked or fixated, it could cause tightness down the back of the leg and the hamstring, or it could actually perceive just almost like you have a short leg, because that sacroiliac is rotated and it kind of pulls up the leg, and so now you're kind of walking around with this one leg shorter than the other type of thing. And again, you could be getting therapy on the back or on the knee, but then if you got off the table and that hip's still rotated and it's showing that leg shorter and tight on that side, you never address the biomechanical flaw, so there's a very good chance of it's coming back. The other thing that needs to be really done is looking for any trigger points or scar tissue or adhesions. And we're talking again, not just around the area of the pain, but all the way up. You need to look in the glutes, you need to look in the tensor fasciae lata, the quadriceps, the hamstrings, the gastrocs. If you're going in and getting your treatment for plantar fasciitis and pain in the bottom of the foot, more than likely you're going to have a lot of tightness in these knots or these trigger points on the back of the calves. Those need to be addressed. Now, initially those should be addressed by some type of deep tissue therapy, massage therapy. I know there's a lot of foam rollers out there and the stick, which I love, but really they're not going to get as specific as they need to be to break up those adhesions. After those are broken up professionally by your sports medicine doctor, your massage therapist, or a trainer, then the stick and the foam roller were very helpful as far as keeping you loose. The last thing that really doesn't seem to be addressed is strength to the buttocks muscles, okay? We really need to address that. What basically some people, you're just, like I said, you're not strong enough to absorb the shock or demands, so you end up with tendonitis or inflammation in a particular joint. So one of the things that we like to do is like a lot of glute strengthening. So you could just Google gluteus medius exercises and follow those type of exercises. And again, that has to do with the back, the knee, the feet. So really what we want to do if you're suffering from a lot of, again, you know, tendonitis, knee pain, plantar fasciitis, hip pain, we want to look at the arches. We want to look at the Q angle, we want to look at the sacroiliac joint, we want to look at any type of knots or trigger points in any of the muscles of the lower extremity. A couple other things that are commonly overlooked is diet. Okay, if you have itis, inflammation, okay, there are anti-inflammation diets that you can follow out there. If you again Google anti-inflammation diet, what you do is you should find some foods that relate to inflammation, and there's some foods that will help inflammation. I'm not going to get in real specific detail on that, but if you have tendonitis, bursitis, again, look into your nutrition. Nutrition plays a role in inflammation. And so if you're saying I'm doing everything possible to fix this chronic knee condition or the plantar fasciitis, think outside the box a little bit and talk to your doctor about the anti-inflammation diet or some type of foods that have an inflammatory response. A couple other things, there are some supplements out there, some essential fatty acids, omega fatty acids, that fish oils that could help. Again, if you look into anti-inflammation, that stuff does work. You just have to stay on it for a while. One thing about fish oils, if you're using fish oils, you need to use a medical grade fish oils. Okay, there are some contamination of some oils out there, so make sure you use a company that really evaluates their oils and uses high quality. One last thing you might even want to look into is what's called a topical magnesium. And again, we find a lot of people that are just kind of tight and chronic stiffness and stuff like that. And a lot of times if you throw like a topical magnesium spray that you absorb into the muscles, it helps with some of that stiffness. So look into topical magnesium, look into essential fatty acids, fish oils, anti-inflammation, arches. I like fixing arches with a semi-rigid orthotic, something that has a little bit more give. And one thing about orthotics I really don't care for is a large heel cup. A large heel cup is a big cup on the outside of the foot that you put into the shoe. If you have a good running shoe, you already have a nice heel cup, in there. And these orthotics can be custom made for you. We could put wedges in one side to help the balance of the pronation of the arch and the angle of the ankle and this Q angle. So do a little bit of search too when you're talking about orthotics. There's a lot of people that have a lot of different opinions about orthotics. What I would do is look for someone that offers some type of consultation about the orthotics and see what the clinics say about it. But I like personally like a semi-flexible without a heel cup, and a heel cup is something like this. This is a very large heel cup right up in here. What that tends to do, if you put it in the shoe, it tends to bring that heel up a little bit too much high. And we see people coming in with a big deep heel cup in a good running shoe, and it seems to lift their heel up, and it doesn't really help their condition a lot. Now that doesn't mean I'm totally against heel cups. Based on certain conditions and certain shoes, they are appropriate. So if you're suffering from some chronic conditions like the tendonitis, the heel pain, the plantar fasciitis, the runner's knee, chronic low back pain, talk to your doctor, your therapist a little bit more about some of those other issues that might be contributing to your pain.